Dental emergencies are often stress-inducing and traumatic, particularly in the case of our young ones. Understanding how to manage any dental emergencies that involve your child will make the difference in getting their needed treatment promptly. The following video will go over the necessary steps to be taking in case there is a dental emergency that involves your child. 1. Keep calm and take note of the current situation. The very first aspect to consider in any dental emergency for your child's dental health is to remain cool. Doing anything to make things worse will only create more problems for you as well as your child. Refresh your breath and evaluate the circumstance. Does your child seem to be in pain? Do you see swelling or bleeding? Do you have a tooth that has been broken or damaged? This is one of the most important things to be considered when deciding how serious the problem is. 2. Stop the bleeding. If you notice that your child is bleeding from their mouth's first step is stopping the bleeding. Wash your child's mouth thoroughly using warm water, then apply delicate pressure to the mouth site using a clean towel or gauze. If bleeding does not end after a short period of time, or if the bleeding is extremely severe, get immediate medical assistance. 3. Make sure to save the tooth. If your child has broken a tooth, it's crucial that you save it whenever you can. The tooth should be held in its top, not its root, and wash it by using water. Avoid rubbing the tooth or pull off the tissues connected to the tooth. If you are able, put the tooth back in the socket. You can also have your child bite into gauze or a small piece to keep it in place. If that's not feasible, put the tooth in an ice cube or some other tooth-preserving solution and then take it to your dentist. 4. Control the discomfort. If your child has tooth pain due to a dental issue, if your child is suffering from a dental emergency, give an over-the-counter pain medicine like acetaminophen and ibuprofen for relief from discomfort. Beware of giving them aspirin because it increases the likelihood of bleeding. Also, you can use a cool compress onto the inside of their cheeks to ease swelling as well as numbing the area. 5. Contact your dentist. After having examined the issue and taken the steps necessary to resolve your immediate concern, the most important thing is to inform your child's dentist as fast as is possible. Tell the receptionist. Ask whether they will meet with your child as soon as possible. If the office for your child's dental is closed, you can leave a message and adhere to the instructions to receive emergency assistance. Be sure to seek treatment immediately early, as timely intervention could assist in saving the tooth of your child and help prevent any further issues. 6. Make sure you are prepared for any future emergency. The importance of preparation is for managing dental emergencies involving your child. You should be carrying a first aid kit with gloves, gauze, and a tiny container to keep a damaged tooth. The contact number of your dentist is easy to access and be familiar with their procedure for emergency situations. Also, it is a good suggestion to make a list of dental emergency clinics in your area to contact during times of emergency that are not open to the public. Knowing how to handle the situation of a dental emergency that affects your child's dental health can be the key to providing them with the appropriate dental care they require. Keep cool, stop the bleeding or save the tooth when you can, control the pain, consult your dentist, and plan for the possibility of future emergencies. With these tips will ensure that your child is given quick and prompt care in the case of dental emergencies.